Well, I've been sick a majority of my life. I've been battling neutropenia since I was a child. The past few years have pretty much taken a turn for the worst. Back in 2006, I had to have my spleen removed due to some complications, which I never really found out an exact reason why I had to have it removed, other than it was really swollen and causing me severe stomach pain. Last July, I'd gotten really sick. I had a severe stomach ache. I had been in and out of the hospital quite a few times before that, dealing with stomach pains and stuff like that, and I had pretty much always gotten the same answer, which was, you know, we'll treat you with antibiotics and then, you know, you'll be fine in a week. I had went to a gastrointestinologist back in mid-July of last year, and I believe it was a $50 payment to see the doctor, and at the time I only had $35 on me, and I was told that I couldn't see the doctor. I had a severe stomach pain that day, and I'll never forget it. I mean, I had gone into the doctor's office and they literally told me that they couldn't see me over $15, so I was pretty unhappy with that. About 2 weeks later, I had worked with a friend, gotten off of work, and I had a minor stomach ache. I, thought I was hungry. Went to a restaurant to get some food, ate a little bit, then just didn't have much of an appetite. Went home that night. I was actually staying at my mom's house. She was out of town, keeping an eye on the house, and I fell asleep. Woke up about 3 hours later, and I was just covered in sweat, and I knew I was going to get sick. Started vomiting, for throwing up for probably close to 4 hours. My stomach ache was getting worse. I kept drinking water to keep fluid in my body, and apparently I wasn't doing enough. I ended up vomiting so hard that I felt something pop inside of me, and I heard it and I felt it, and within just a couple seconds of feeling it, my whole lower abdomen just got really warm, and I had woken my girlfriend up at the time and had her rush me to the emergency room. I was in the emergency room. They took me in right away, and I just kept telling them I had a bad stomach ache. They kept giving me pain medication to take away the pain, and it just wasn't working. Next thing I know, I woke up, and my family was all around me, and I had tubes and all kinds of stuff coming out of my body, and I just had no idea what was going on. And the doctor asked me if I knew what day it was, and I told them that it was Monday, and they all took a step back, and I'm like, no. All right. Tuesday, no. Wednesday, no. Like, it's Thursday. And I was like, oh, wow, I've been out for 4 days. And they're like, no, you've been in a coma for over a week. I ended up spending a month in the hospital. Woke up, had an extra bag at the time. I had a colostomy bag as a result of having a section of my colon removed. And turned out I had a grand total of about $350,000 in debt to the hospital for all the ICU and all the different doctors and specialists and stuff like that. And basically all because I didn't have health coverage at the time.
It's hard to find words. It's just heart-wrenching. Boy, it's terrible, just to have a child or any relative really that you're close with, especially a child, though, to have to go through this, and there's you feel helpless because there's nothing as a parent that you can do. I mean, you spend a lifetime raising your children and trying to provide for them and help, you know, with their problems, and get something like this where it's just monumental. There's nothing you can do. It's hard. It's very, very hard. Very, very emotional. I would like to see it this be a little less polarized politically, and realize that these are people's lives and well-being that we're talking about, and what price do you put on that? I mean, I would like to see the system fixed, made more efficient. I mean, the whole system, the doctors, the hospitals, pharmaceuticals, insurance, even the lawyers and that type of stuff. So that people, who don't have insurance and really don't make enough money to pay high premiums and prescription costs and everything, that it would at least be available for them when they do get in a critical situation where they really need help.